I'm Liz.
This is Colleen.
This is Mr. Midline.
Dude, you guys, we're just starting this one off laughing. We've been like having this really deep discussion because we're going to talk to you guys about perimenopause now. We started talking and we were on a roll. We were so into it. 20 minutes in, probably. Didn't even have our microphones on.
No sound.
No sound.
No sound. I happened to see it out of the corner of my eye and was like,
oh God, she saw them out of the corner of her eye. Because otherwise, I would have probably, like been back doing editing later and being like, why can't I hear anybody? What's wrong? It would have been a total waste of
the time
of recording time. Not that the conversation wasn't great.
It was right.
But we're definitely we're definitely warmed up for you guys now about anyways, a discussion based on our prior discussion when we were talking about it being her birthday and her turning 40. We talked about perimenopause.
Yeah.
And it's not a negative thing. Neither is menopause. No. These are just stages of our life. And I do feel like now it's so beautiful and wonderful that all of this is finally being talked about.
Yeah.
That we're being given so many tools to work with now. Whereas my mom's generation and some of the generation prior weren't given these tools. They didn't really talk about it. Nobody shared with each other what they were going through. No. And now my generation, thankfully, your generation and Gen Z gets to go through this in a much better fashion.
Yeah, and it's not like HRT is no longer
they can talk
like
about it.
Black
and I'll go into that a little bit more as far as that discussion goes.
Yeah.
But, from a medical standpoint. But so let's talk again about symptoms. What did you experience when you were in your late 30s there? What came on as far as the symptoms that you experienced?
Yes. So I am pretty sure that I started the very beginning of it, probably when I was 35.
Okay.
Started having
not uncommon from what I'm hearing.
Yeah, little baby probably things.
Changes in the cycle.
Yeah, the last thing that you had mentioned earlier was the ear itching, and I do remember there was a period of time that I did have really itchy ears.
You're like, what the heck's going on?
Yeah, and
nobody talks about that. They always only talk about hot flashes.
Well, and the thing is, I had hot flashes in my 20s when I was on birth control, but I did not. I think the ear itchiness I just associated with allergies because it is, but I know a ton of women that have issues with itchy ears. And I feel like that's just a time period. It probably lasted 6 months and then it was done for me. And maybe it's the same for other women. So I'm curious. But periods started getting worse.
Changes in the periods, changes in the length of your cycle or sometimes the regularity of your cycle.
My cycle
stayed pretty on.
Well, it was about the same up until last year.
Okay.
Started getting, or 2 years ago, it started getting really bad. Last year was when I got on HRT. So I've been on HRT for almost a year. So I do testosterone pellets, every 3 to 4 months, depending on how I'm feeling and how my blood tests look. Cause I do get my blood tested every 3 months, both for my hormones, but then also because of the anemia. So, and I think that part of the anemia, or a big portion of the anemia, was due to an increase. I already had heavy cycles and it was I'm hemorrhaged every month.
Yeah.
And so finally, my body's girl, you're depleted. And so that, and then, I wasn't I'm a really good sleeper, but I was having problems
going to sleep.
Okay. And that was something, and it wasn't because of an excessive amount of caffeine. I'm mindful about that. I was not in my 20s. I was a psycho about caffeine in my 20s, way too much. But that, and then, I have had issues with crepey skin and stuff. So I've been doing the estrogen cream on my arms and my hands. And our PA did allow me, because I was doing some research, she did allow me to give the lowest dose estrogen patch a shot. But it did, I think, bring back the lipedema that I was having issues with.
And sometimes it can cause more bleeding issues too as well.
Oh, interesting.
Yeah.
I don't think it affected me in that way. But, and then I cycle with the progesterone. I do 100 milligrams of that. I tried the 200. That was too much because then I was waking up groggy. But after I ovulate, start the progesterone because I was spotting about like a week before I should have, like I was going to be starting my period. And so that's
there's a sweet spot for all of these hormones. The problem is like we were saying earlier, whoever is taking care of your hormone replacement therapy, they need to be really well versed and well trained in it. It's a cycle naturally, and so they really got to know how to finesse the combinations of the hormones involved. Blood tests are not super accurate.
Based upon where you are in your cycle.
It's based upon where you are in your cycle. It's also what's free flowing in your bloodstream, but you could still have what's considered an okay level of estrogen via your blood test, but it's not being utilized by the body correctly. And it may be that big one day and then low the next day because the ovaries are starting to
do some weird things.
Yeah.
Well, that, and then like just, and doing your own research is important and like figuring out and like learning to really listen to your body.
Progesterone's important too.
So important.
Incredibly important.
So important. Well, and then the other thing too is like lowering your cortisol, like lowering the stress that you have exposure to. Really paying attention that like some people need more sleep. I don't always need a ton of sleep, but like I do know some people that are like,
I love my sleep.
I do love my sleep.
And I'm not as good with it as I'd like to be.
Yeah. For me, sometimes too much sleep is not good.
Yeah. But getting that good old 8 hours that they always talk about feels good.
Oh, yeah.
Yeah, definitely. Also want to keep an eye on your testosterone. Because everybody, I think, automatically thinks that testosterone levels, that testosterone is just the male hormone. Males have estrogen too. They just have it at a much smaller amount than we do.
And we need that. I think
we have it at about 1/10 the level, I want to say, that men do.
Yeah.
But when it comes to fatigue, when it comes to sex drive, real important one there. Keeping your muscle mass.
Keeping the muscle mass. The other thing too is I think that getting on the pellet helps my anxiety.
It might have
that leveled me out because I had
helps with depression. I've heard that for sure.
Oh, interesting.
Yeah.
Well, I had severe anxiety last year, just out of and unnecessary.
Yeah, and that's kind of standard with perimenopause. You start having more issues with anxiety and with depression.
Yeah.
So it can be real helpful. I know Liz was just talking about being on the pellet. Pellet didn't work great for me. My levels got a bit too high, even on the lowest dose. So sometimes you've got to be in a situation where you can really work with your practitioner to find different routes, different delivery systems, ways to keep your levels at a more reasonable level. Because there are side effects with testosterone if it gets too high. You know, actually, I didn't have any of the really bad ones. I just knew that it was aromatizing to estrogen. So then my estrogen levels were getting too high. On top of what was going on. So,
and I don't
really got to have somebody that's able to finesse these things because it's very important.
Well, and I'm curious as far as what helps that because like I work out 5 days a week, and so or I try to get 5 workouts in a week. And sometimes I'll have to like make it so I do a double on a day. But I don't know if that's what is helping me work with my testosterone. I don't know if
that's the thing is that everybody's going to be completely different.
Totally different, yeah.
But of course, exercise, weight training, diet, high protein intake.
Okay, y'all.
All of that's going to be super, super important. You don't want to be losing your muscle mass.
No.
At this age.
No. I literally doubled my protein. I was getting like 70 grams of protein in. I try to get between 140, like typically every day I get at least 140. But 140 to 160. And in 6 weeks, I gained 7 pounds of muscle mass.
Oh, that's awesome.
And
now we have these little tools here with our rings and stuff like that. And our scales that tell us what our...
Well, yeah, I would go in a NutriShop and the manager there was like, dude. And I was like, okay, I don't know what that means. And he's like, that's incredible.
I bet the testosterone was helpful.
Well, because that's but
and the
adding
protein.
but adding doubling the protein was the
Mhm.
only thing that I had changed.
Yeah.
And that's something that I will say, getting your protein intake in is vital.
Yeah.
Vital. Also,
And we talked in that earlier thing too.
yeah.
If you are taking GLP-1s, that is the main problem that I've seen with the way that GLP-1s are being prescribed right now. A lot of folks are just prescribing it, sending them on their way. I've seen a lot of weight loss clinics, particularly, that seem to start at that starter dose, but not really monitor the symptoms of the patient. They just want to see that really fast weight loss because it makes them look good for what they're doing, and they'll up the dose really quickly. Well, then that patient's basically starving themselves. They're not getting enough protein in. And in addition to that, if you are going to be on a GLP-1, you not only have to make sure that you're getting adequate calories and adequate protein, but you are working out.
Yeah.
And when I say working out, I mean more weight training than anything.
Because you will lose your muscle mass.
Yeah, you will lose your muscle mass. In the same vein, if you were on a starvation diet of any kind without taking a GLP-1, you're going to lose muscle mass. Yeah. So I don't necessarily believe that it's the medication itself that is causing the loss of muscle mass. I think it's the habits involved. With a lot of people that, quite frankly, like that feeling of not wanting to eat. Yeah. I really do think it does exacerbate some people that have maybe had prior issues with eating disorders. So they need to be really careful,
diligent,
and monitoring a lot of these patients using lower doses. If you're losing weight at a reasonable rate and seeing good health effects, why keep pushing that dose up?
Yeah, it's not.
We don't want people to starve to death, basically. And I do think that we will probably in the next 10 to 20 years see a lot of people that have developed osteoporosis, more fractures because of the loss of strength, that kind of thing, because they didn't do the additional things while they were on a GLP-1.
And they've already seen some of that happening as far as like bone density going down. And then the other thing too is your heart is a muscle, and if you are not doing muscle protective things, that in of itself.
Now the GLP-1s are great though. They've seen, as long as somebody's eating correctly, doing that weight training, etc., blood pressure drastically improved. A lot of times cholesterol ends up drastically improved. Of course, your A1C ends up being drastically improved, especially if you are already pre-diabetic or you are already moved into type 2 diabetes. So this does relate to perimenopause.
It does.
Because you're seeing so many of the people that are taking the GLP-1s are perimenopausal women. Because they can't get on top of the hormonal changes and the weight gain that they've had. A lot of them, type 2 diabetes has increased drastically over the past 20 years. So that's a smart way to attack it, but it has to be monitored correctly, and it has to be handled correctly.
Absolutely. Well, that, and then like estrogen based lymphedema, or what would it be considered?
Lipedema.
Well, but the estrogen being the cause of it more so, because I see the lipedema with women, predominantly within women. And in that like middle-aged range,
they've seen some good effects with that.
It helped me.
Well, and I think a lot of people don't realize too, GLP-1s are very anti-inflammatory as well.
Also, that it's helped significantly for me.
Yeah. So I know we just went off on that thing, but we had talked about it earlier.
Yeah.
Before I even started going into perimenopause, I had some issues with PCOS for a while. So GLP-1s for a lot of women, especially in their 40s, and going through perimenopause, GLP-1s can be great if managed correctly, but I think they're even better with hormone replacement therapy on the side and other modalities being used with them. It's like the perfect mix when you get everything right there.
Yeah.
Yeah.
It's definitely helped me.
So talk to your doctors about it, or your nurse practitioners, or your PAs. Find somebody that is very, very well educated in this. You're going to run into people still that are just like, the minute you start talking about this, they shut you down.
Or they just shove birth control in your face.
Yeah, that's very standard. That used to be a woman came in and started complaining about maybe her cycles becoming irregular, maybe increased period pain. Other symptoms that we associate with perimenopause now, they just be like, here, we'll put you on the pill. And I was offered it.
Yeah.
And I was like, no, I'm heading towards 50. aren't there some additional risks here? You know, I'm a nurse, so
yeah.
Maybe not great for my stroke risk or blood clot risk, you know, that kind of thing. And of course, even bioidentical hormones have their risks. Don't get me wrong, but I think bioidentical stuff is probably much better.
Yeah.
When managed correctly.
When managed anything when managed correctly.
Mm-hmm.
For sure.
So, yeah. And then shall I go on my rant about?
Well, yeah.
About
what are there any other symptoms that you've had, like, or
so
have experienced?
So I had some similar symptoms as I moved out of, you know, towards my 50s. I would say specifically, I also had some additional other health issues because of the PCOS, type 2 diabetes. I had gestational diabetes with my son. So of course the weight gain, the changes in the cycle that were occurring. I've always had quite a bit of pain with my cycles when I have them. Also mid-cycle pain, history of cysts.
Yeah.
All that kind of fun stuff as well. But I was getting shoulder pain and hip pain and the itchy ears. And I'm trying to think what else. Not a lot of hot flashes.
Yeah, I haven't had any hot flashes, but I did, like I said, I did have those in my 20s.
And no serious loss of libido, which a lot of my friends are saying that was major. There was usually a loss of libido around that time as well. But how much of that is due to stress and other issues?
I will say that is something that I did have.
Yeah.
Before getting on the pellet. But I was like,
once you get some testosterone on board, you're like, woo, let's do this.
For me, that was like, what is going on?
Yeah.
That I knew something was awry.
Yeah.
Because that's not typical for me.
Yeah.
So that was something that I noticed that I didn't like.
About perimenopause in general, that loss of libido. Yeah.
Yeah, because then it's just like,
yeah.
But it's
not so much that you're like disgusted by it, but just you're like, I don't know if I have enough energy. I just,
or just
go
like
to sleep instead.
But it wasn't like I was just like, I had zero desire for it. And I was like, that's not normal for me. So I knew something was awry. Yeah. But that definitely is. And I have a lot of friends that have had that experience. And so it's like,
very, very common.
Something's different.
Yeah. So, and another thing, and I know my mom would in no way be mad at me for talking about this stuff, but a very big chunk of my mother's generation, the boomer generation, and then some a bit older than her as well, have problems with chronic UTIs and problems with vaginal atrophy, urethral atrophy as well. So back in 2002, I want to say, the Women's Health Initiative came out with a study that basically shut down all hormone replacement therapy at that time. So doctors were replacing estradiol and also progesterone for some people. I worked for an OBGYN at that time during that study, and he was prescribing hormone replacement. And then that study came through, and everybody was terrified from a legal perspective because the way that study was run, it made it look like there was a much higher chance of cancer if you especially combined estrogen and progestin. So I want to say they were using, actually in that study, not bioidentical hormones. They were using, I believe, ethinyl estradiol and a progestin. Or they might have been Premarin. Prempro was the big one at the time. So it was Premarin and a progestin. I think that it was a very minor increase. And of course, you always do have to take into consideration, even now, those cancers that are specifically stimulated by estrogen. So of course, everybody needs to really be talking to a healthcare professional, 1,000%. To a doctor, to a nurse practitioner, to a PA that specializes in this, to avoid running into any of those issues. But they literally scared everybody off. So nobody got any hormone replacement. And all of these women now are really suffering. So thankfully, black box warning was just taken off of the vaginal estrogen tablets and vaginal cream, because it does, for the most part, stay local.
Yeah.
Wherever it's inserted or applied, stays pretty local to that area. They have seen American Urological Association, when they released their guidelines, they are expecting a huge reduction in hospitalizations for UTIs, urosepsis. They're saying that this could create less deaths, of course. A lot of times when you have UTIs, you get that altered mental status, you have falls involved. So a lot of times it can be a death sentence for older women, and people don't realize that.
Yeah.
So hopefully our generation, my mom's generation, kind of took the bullet on that one, and they're suffering from it. I did finally find a urology practice that has been so wonderful to my mom. They've replaced her estrogen vaginally, and she's doing much better now. But I was like, I'm not going down like that. I'm going to take care of this from the beginning. And now your generation's going to start even earlier, keeping an eye on these things.
Absolutely.
My daughter's generation will keep an eye on these things earlier. They were even saying in that American Urological Association paper that sometimes vaginal estrogen would be great for women that are breastfeeding, or even on birth control pills as well, to make sure that the estrogen levels in the vaginal tract stay high enough to keep those tissues healthy. Because you're not making a lot of estrogen when you're breastfeeding.
I didn't even think about that.
Yeah. So I really love that we're doing more studies now, that we're keeping an eye on these things, and we're encouraging women to talk to their providers about this
Also,
stuff.
talk to each other.
Talk to each other about this stuff. Give each other information. And if you guys come across a provider that really is into this and loves this and has done all the research, make them go to that particular doctor. Because sometimes they'll go to a doctor and the doctor's like, no, you're fine.
Yeah.
Your levels are fine. Whatever.
I know too many women that have had that experience,
and it very much needs to be symptomatically based.
It does. It needs to be symptomatically based. It needs to be listened to.
Mm-hmm.
It needs to be advocated for. And I think also like self-advocation, that's really important. And also like just knowing yourself. Like we talked in the one that didn't come through, we talked about like from the time that you start your period, like we both started very young.
Yeah, I was
11. Probably 11. I remember being like not third grade, like I think fifth grade maybe?
It was fifth grade.
Yeah. And so you are only going to cycle for so long, and like not having children, and because I do think that can maybe prolong the wait of hitting it. And then how long you were on hormonal birth control, which I was on hormonal birth control for 15 years straight. And then getting off of that, I think when I hit 30, I think that just fucked me hardcore for a handful of years afterwards. And then my body finally got used to it. But then I was like, wait, what are we doing now?
Yeah.
So I think that there's a lot of factors that go into it.
I just love how much we're willing to talk about all this stuff now.
Yeah.
Sorry, you guys. I didn't turn my phone off again.
See?
We're just going, hold on. Just ignore me. Just look the other way. Gonna put it on silent here. You didn't see anything.
Unedited.
Don't look at the man behind the curtain.
But I think that like there's a lot that we need to really pay attention to about ourselves and know about ourselves and understand the importance of
educate your daughters too.
Educating yourself, educate your daughters, educate your girlfriends. Like I can't tell you how many clients I've told once I like for the last year, various clients that I've told that are in my age or a little older, where I'm like, oh, I'm doing X, Y, and Z. And they're like, what?
Yeah.
Tell me more.
Yeah. The numbers are going up, but it's still not that high yet as far as hormone replacement therapy goes. And it may not be right for everybody. That's why you definitely need to go talk to a really good provider about it. But also, I think that we're great at communicating and a lot less shy about talking about what our perimenopausal side effects are. Yeah. Like we were talking about that all of a sudden your deodorant doesn't work.
Oh yeah.
What the hell?
Oh my gosh. I have figured out what works perfectly for me. And I do like a natural like bar of soap that I use, but then I use you recommended trying the Lumi acid wash.
Yeah, because you want to keep that acid mantle of the skin healthy so that bacteria don't grow there. We have very acid based we have that acid skin mantle going on. So if we want to keep it strong, using something that has something acid-based is going to be good. And Lumi's great for that.
Yes. So I do
It
that.
smells a little bit weird in the bottle, but it's fine once you use it.
Yeah. I do that. And then when I get out of the shower, I use hypochlorous acid, which our PA told me about that.
Yep.
I'm obsessed.
Non-toxic. Use it for cleaning. Use it on your body.
Yes. You can put it.
Baby butt rash.
Yeah. You can put it in your eye if you have pink eye or any sort of like irritation in your eye. I use it as my toner when I get out of the shower. But I also, underneath here. And then once that's dry, that's when I put my Lumi deodorant on, the cream, like the actual like little tubey cream instead of the stick.
Yeah.
But yeah, like
it's always just weird stuff. I want to say somebody told me like last time the list is like there's like 50 different side effects that really are noted throughout most of the general population.
Yeah.
Not just everybody just thinks hot flashes.
It's not that.
Or sometimes, for instance, you could get testosterone in a cream form from a compounding pharmacy if you specifically mentioned that you had sexual dysfunction.
Oh.
And that was about it for women. It was still not, it's not in any way produced. Now it is in a few countries and it's probably come in this direction as well to the US, but it wasn't made for women. It was just assumed that that was not something that you would be supplementing to women.
Yeah.
But it doesn't just work on libido.
No.
It has other good effects in the female body. And I also think that it probably helps from things I've heard reported from different studies, probably helps with staving off dementia.
Oh, that was another thing too.
Brain fog.
Brain fog.
Yes.
Good grief.
I still have that anyway.
But you know what is super helpful?
Not as bad as I did, man. I thought I was losing my mind for a while there.
That,
but that was also post-COVID. So I was like, okay, how much of this is COVID brain fog? How much of this is menopausal brain fog? Those kinds of things.
Absolutely. But I will say doing creatine, I do 10 milligrams of creatine.
Oh, I do more than that, girlfriend.
Yeah. Well, and like everyone's different.
Yeah, definitely, go do some research on that because there's been some newer studies now, especially if you travel a lot, if you fly a lot, and you have that, cognitive issue because you've been flying too much and that kind of stuff. 25 grams in that day will help lift that brain fog.
Yeah, well, yeah, they say that
there can be GI distress too, so don't just be hopping on that bandwagon.
Well, and it can affect your kidneys.
Yeah, so your creatinine,
creatinine
can be affected, your creatinine levels. I will say I take 20 to 25 grams a day and I have not had that issue, but it is very common for people if they go over that 5 sometimes.
I was gonna say my creatinine,
creatinine can be slightly elevated.
Mine's slightly elevated.
But it's not necessarily, it's just because that's
what's happening. I'm taking
that's the metabolized. Yeah. So it's not necessarily something that they need to worry about. But yes, I mean, obviously you would want if you were in the ER getting your labs drawn for something, you'd be wanting to tell them, hey, by the way, if my creatinine comes back a little bit high, it's because I take an absolute ton of creatine.
Yeah.
So definitely talk to your doctors about that. And if you can find a good functional medicine doctor, that would be huge. So, because if you're combining all of these different things together, you want to make sure that your supplements.
Yes.
If you're getting additional peptides. Those kinds of things.
Yeah. Peptides, which the vitamins, I've been on a train for vitamins for about a decade.
At least your basics. Your magnesium is going to be really important. Vitamin D. C helps support collagen. Zinc is a big one.
Yeah.
Especially with your hormone levels.
Well, and magnesium is required for over 200 different processes in the body. So,
and most people are deficient. Yeah. So same with D. Big time. D3 specifically.
D3 and K2.
Yeah, D3 and K2. Especially a good one. So definitely talk to some professionals about this kind of stuff.
Yeah. And
since we're not your provider.
We're not your provider. But we are Chatty Cathy's that have found a great provider, and we also really
I feel a hell of a lot better than I did 10 years ago. So to say that at 50, almost 53, when even just 6, 7, 8, 9 years ago, I was a completely different person.
Oh, I feel better than I did 5 years ago.
Yeah. To move into your 50s feeling better than you did in your 40s is
legit
the way to go.
Yeah.
Yeah, definitely.
Yeah. I think there's a lot to be said really, again, for knowing your baseline, listening to your body.
Mm-hmm.
For those who are like curious, I go to NutriShop to do my in-body testing. NutriShop is like everywhere, and I think every single one offers in-body testing. So
there's a lot of scales available though, even online
that you can
now.
get online.
The one
Yeah,
that I have one in my house.
yeah, and
I literally have to pull the thing up and hold the bar. It tells me what my water content is, my bone mass, my muscle mass.
So yours is basically an in-body
It's
testing.
basically in-body testing.
So it's something that if you're not wanting to invest in that, but you want to get a free scan, it's worth it to go in and find out. Also, find out what your basal metabolic rate, which is your resting required caloric intake in the event that you were in a coma. And that's how much you would need in order
to just get by if you weren't working out.
To sustain your muscle mass and your life. So that's something that you want to know to begin with.
And InBody has an app attached to it, so you can keep an eye on that as well.
Absolutely.
So you can watch your progress over time.
Yeah, but it's important for us to know these things.
It's nice that it's free.
Yeah, and get a full blood panel. Again, I get my blood tested about every 3 months. I'm a psycho about it.
Well, that's because you have a specific issue.
I have to be, but it's like at least once a year. And ask for a full CBC, ask for full hormone workup, ask for, what are the other ones that you would potentially, like additional, like your vitamin D, vitamin B?
Yeah, definitely get your vitamin levels checked. But I also, of course, because of my family proclivity and my prior issues, I always get my A1C checked.
Oh yeah, that too.
At one time before I really started this journey, my homocysteine and my C-reactive protein was incredibly high, which is indicative of really bad inflammation, which could be also indicative of heart issues, cancer, etc. Now I'm at the very bottom range of normal.
Amazing.
So monitoring that can give you a really good idea of what's going on within your body.
Perimenopausal situation for those who have heavy cycles, please go get both your circulating iron and your ferritin checked. Your ferritin is your iron reserves. That is what mine was in the absolute garbage tank. And if it gets 20 and below, that is where your body is doing everything it can to just protect your organs, because without ferritin, your blood cannot circulate oxygen where it needs to go to in the body, and it's very dangerous. And I've seen a lot on the internet, on reels and women commenting and stuff, that a lot of women have severely low ferritin. So and it's not just getting enough iron, and it's like there are co-issues. Like I just was reading today about the fact that Epstein-Barr virus, which if you had strep a handful of times when you were younger, likely carry it, which I did have RPA check last year to see if I still had it, because I've had strep throat at least 65 times in my life.
I had it severely, especially when I was younger.
Yeah.
Constantly.
And I still test positive for
and I had Epstein-Barr.
Yeah.
Well, I had Epstein-Barr virus later on. I actually had an infection with that years later.
Yeah.
Got it at the same time as parvovirus.
Oh.
So not the one your dog has.
Oh, I was going to say, what?
It's the one that causes childhood Fifth's disease. I don't know if you guys have ever experienced that before. My kids had it at the time. So it's like that spider webby looking rash, red rash. Kids get like a high fever, runny nose, resolves relatively fast. And with little kids, not really a dangerous disease or anything. And almost all people have it when they're little kids. Apparently I somehow skipped that. Maybe it was the whole only child thing. So I ended up getting it from them at the same time that I contracted Epstein-Barr, and all of a sudden my joints swelled up so bad. I was like in my 20s when this happened.
Dude.
Couldn't bend my fingers. It was almost like a rheumatoid arthritis type reaction. It was obviously autoimmune reaction to it. And that took many, many weeks to recover from.
Whoa.
But yeah, strep, had constant strep and tonsillitis. And it went away for many, many years. And then in my 40s, started experiencing it again and got my tonsils out when I was 45.
Oh, shit.
Because it was so bad, which I don't suggest anybody ever do that at that age.
Literally,
was horrible.
I think past the age of 20, they don't recommend it anymore.
Yeah, they had to.
Dang.
My little tonsils looked necrotic. So yeah, just things things to keep an eye on, because you're seeing all sorts of stuff now where they're like, hey, if you chronically had strep when you were younger,
literally that's what it's saying, that like even like PCOS can be a actual like cause of Epstein-Barr virus and endometriosis.
I don't know that I agree with that from a medical perspective.
The way that
or they could be correlated.
Well, the way that they were
Correlated,
describing
not
it is
caused
if you
by.
had streptococcus, then found its way into your.
It goes systemic.
Yeah. So then it was possibly in your womb area,
Ugh.
which is crazy. So yeah, there's so much more information.
I'll have to read up more on that.
It's fascinating.
Yeah.
I'll send you the thing. But yeah, the whole point.
The whole point is advocate for yourself. Yes. Find a physician, a nurse practitioner, or a PA that is going to advocate for you, that really wants, that like enjoys looking into this stuff. And that is why I'm going back to my nurse practitioner right now. So maybe I'll be great at it. Maybe in a couple years I'll be talking to some of you guys about this kind of stuff. So we'll see. But until then, I'm not your provider.
No.
I'm not giving medical advice.
No.
I'm just saying find somebody that's awesome.
Yeah.
And that really is going to help you, because it can be life changing.
Oh yeah. For sure. Who I am this time versus last year.
Thanks, Emily.
Girl. Yeah. Thank you, Emily.
Thank you, Emily. We love you, Emily. We'll have her on at some point, I'm sure.
Oh yeah.
Yeah.
I've already told her.
Yeah.
And I think you have to.
Yes. I think we've already been like, so.
You.
Yeah. Once we get some more viewers and stuff.
Yeah.
So, yeah.
Yeah. So, well, if you guys have any additional symptoms or any experiences perimenopausally, or
things that have helped you.
Yeah, things that have helped you. Share in the comments.
Yeah, talk about it.
Share with the class, because it is just like with everything, and this goes back to the ancient sisterhood that we have. Women are how things get circulated.
Yes.
And this is the type of gossip that's really good.
Yeah.
Share with your sisters.
Share with your sisters. Educate your daughters.
Yes.
Don't make them afraid to talk about any of this stuff.
And advocate for yourself.
Yeah. Teach them about their cycle so that they're not afraid of their body.
Please.
Teach them all about how all of this crap works. And learn about it yourself if you don't already know about it.
And also like look into what can help, like naturally. Like there are teas that can help with your cycle. There are taking certain vitamins, eating a steak at the beginning.
Yeah, there's always going to be women that do not choose to go the hormone replacement therapy route, and I'm 100% in support of them. If they are into herbalism,
love it.
Just using supplements, using other modalities,
all of it is great.
The whole point is just putting effort into feeling better.
Yeah. And do what works best for you.
Emotionally and physically. Yeah. All right, you guys. Howdy ho. We'll see you guys later.